You are watching Mental Health Monday with Chuck Bastie. Sorry about a little bit of a technical issue there. Just everything lined up. Chuck, how you doing tonight?
I'm really excited, Gooch. How are you doing?
I had a little lag there. Sorry. Something crazy going on with the internet. Today, too, on my show, didn't even start until a minute into it. I was talking away, no one even heard me. So I apologize for that. I hope this will work out with you on your side. Thank you so much for bringing in an incredible guest. I had an opportunity to take a little bit of his look at his website, read the stories about it. ADHD, of course, ADHD. Of course, you are going to explain to us what that means in layman's terms. I think a little of it. That's why I'm really excited about listening to this tonight, listening to you obviously interview Dr. Barkley.
Yeah, I was was perusing the internet as you do, and I was looking for some ADHD content, and there was a woman named Jessica McCabe, and she led me. She has a website on YouTube called How to ADHD, so it's an amazing site. She shares from a vulnerable standpoint of her experience with ADHD. And I noticed she had left a comment on this guy, Russell Barkley's website. And I'm like, well, she's like talking about how much she admires him. I should probably look into this guy. And it turns out it's Dr. Russell Barkley, Ph.D., one of the world's most internationally renowned ADHD experts. And we're just overjoyed to have him on the show today and share with us a lot of information. We're going to have a full hour talking about this, and we might even have to have Dr. Barkley back for another hour sometime in the near future, because Absolutely. This is something that every parent, every coach, every manager, every supervisor needs to understand, because you're dealing with people out there that actually have ADHD and you don't know it yet, or they don't know it yet, and it's causing a lot of chaos, and it's an avoidable chaos. So,
and especially at this time, obviously with the pandemic, I'm sure it adds to the overall situation. So listen, I'm really excited. One of the greatest guests you've brought on the show so far. Thank you for this. Obviously, Mental Health Mondays brought to you by the Connected Mental Health Platform. Chuck, thank you. Have a great show. And let's bring up Dr. Barkley.
Hi, Chuck.
There he is. Welcome to the show, Dr. Barkley.
Thank you.
I'm going to start off by calling.
What a pleasure. What a pleasure. Thanks. It's always part of my career mantra, as you know, is disseminating the science of ADHD to anyone who's interested in learning about it. So thank you for having me on.
Yeah, and we're really fortunate too, because this is the start of Mental Health Week here in Canada. So to have you on for the start of the week on Mental Health Mondays is a wonderful treat for all of our viewers that I get a chance to get into your content. And I'm overjoyed right now, and I can barely contain myself. So I'm just going to dive in right now.
All right, guys. Chuck, thank you. Dr. Barkley, I will see you. I'm down below. Producing, guys, have a great show. Really looking forward to this.
You bet.
Thanks, Gary. I'm going to dive into to the conversation of just so I'm going to assume most people here, if they're tuning into the show or they find the show on the internet, they know a little bit about ADHD or ADD, but I just wanted to start disseminating the difference between ADD and ADHD and just defer to you for that.
Sure. I'd be glad to help. Well, first of all, ADHD, when you read about it on most media, websites, and so on, is going to be portrayed as a disorder of inattention combined usually with problems with impulsiveness and hyperactivity. It's a neurodevelopmental disorder, which means that it's largely neurological and genetic in its origins. It's not due to screen time and diet and social media and so on. So you're going to be hearing about those three major symptom groups with people with the disorder. And then ADD, which unfortunately is still being used, is the 1980s term for the same disorder, but clinicians have held on to that term, as have others, despite our moving on to ADHD to replace it. They're reserving that for people who are primarily inattentive but don't have the hyperactive and impulsive behavior. That's kind of unfortunate, because there really is another attention disorder that I'd be glad to come back and talk about that's been discovered in the last 20 years. It's called sluggish cognitive tempo. I don't like the word. I prefer concentration deficit disorder. It's very different from ADHD, but because there's only one attention disorder officially recognized in Canada and the US in our DSM-5, and that's ADHD. It often gets called ADHD inattentive presentation, or ADD for short. That's unfortunate. But so there's two attention disorders out there, but ADHD is the big gorilla in the room, and the one we're going to talk about this evening.
Fairly well said. I get a little caught between the misdiagnosis of the ADHD, and I know on your content on YouTube that I've listened to, you go into a little bit about the difference between attention deficit of what the condition really should be called. So I just thought we'd start again with that.
Yeah, I'd be glad to. As I said, if you look at it superficially, based on our diagnostic criteria, ADHD is a problem with inattention, hyperactivity, impulsivity, that sort of thing. But those are the most obvious and kind of superficial symptoms. It's a lot like referring to autism spectrum disorder as hand flapping and bizarre language and stereotypic behavior. But there's a lot more going on in the mind, under the hood, so to speak, in autism, just as there is in ADHD. To put it briefly, ADHD is a disorder of self-regulation, the ability of people to control their own behavior rather than be always under the control of circumstances around them. And that means that ADHD is a disorder of executive functioning, because the frontal lobe here of the brain gives us about 7 different mind tools or mental abilities that we call the executive functions. And they allow us to regulate our own behavior. And if you like, at some point, we can go into what those are. Obviously, inhibition and self-awareness and other things are part of that. But really ADHD, if we had to rename it, and we won't for political and legal reasons, should really be called EFDD for executive function deficit disorder, or self-regulation deficit disorder. That would be much more closer to the science and the truth than ADHD, which kind of belittles the disorder and makes it sound trivial, when in fact it's as serious as many of the other major mental disorders are.
One of the things that you mentioned earlier on in your explanation there is the self-awareness side. Yeah. And obviously, when it comes down to self-regulation, do people with ADHD, do they have the ability to be self-aware, number one? And number two, would it make a difference even if they were self-aware in the fact that their executive function is impaired, and being able to actually execute that?
The short answer is no, they don't. But remember, ADHD is not a complete loss of these executive functions like self-awareness. It's a relative deficiency compared to typical people. And when that deficiency becomes so extreme that it leads to harm and impairment in the individual's life, then it becomes a classic disorder. That's where normal leaves off and abnormal begins. And so one of the 7 executive functions, and indeed the first one to develop in childhood, is gradually becoming self-aware or attentive to yourself and what you're doing. And because they're delayed, not completely absent, but delayed in their self-awareness, they're less likely to appreciate how much trouble they're causing themselves and that they're getting into by the way they're acting. It's often after the fact when they finally realize that they've allowed themselves to go on a little bit too far. And so self-awareness is step 1 in the 7 steps towards self-control. And without that, there is no self-control, because there's just no self-awareness. So that's why in the DSM-5, our new criteria, we added a new step to the criteria that requires that you corroborate what people tell you against other sources of information like loved ones, parents, spouses, school records, and so on. Because the person with ADHD is often the last person to get it. They're often the last person to realize just how serious their symptoms are and how much trouble they're really in. Because often what we hear is they blame others and circumstances and their past and their parents for the trouble that they're in without owning it. And, ownership of your disorder is step 1 in getting any assistance for it. And that's part of the self-awareness problem.
Gotcha. I'm just going to invite everybody who's watching right now, whether you're live with us on Facebook or you joined us through YouTube channels. If you want to ask Dr. Barkley a question, you can please feel free to chime in on the side. We'll try and get to as many questions and get you as many answers as we possibly can for tonight. That being said, what I wanted to ask you next is basically with ADHD, I could go on and on about what I think it is. That would be very arrogant of me. Obviously, you're world renowned. Inside of that, I want to talk to parents, coaches, teachers, supervisors, people that are in positions of either power, management, or being able to teach younger kids. We live in a totally different world of education. You and I had this conversation last Wednesday on the phone. That in my generation, and I'm 49, they taught us in a certain way, and we had to adapt as students to every teacher's style of teaching. And now we're slowly starting to get back into understanding, executive function and be more cognitive of their learning abilities and how we can actually have them learn and be engaged with us as well. So when you're speaking to parents, teachers, coaches, what are some things that they can see as far as traits or behavioral red flags, if you will, for noticing ADHD or being able to understand that this person isn't being difficult, they're not being chaotic or disruptive, but they might display these traits which are now ADHD?
Yeah, well, it's a great observation, because the first way that parents and others recognize, including adults with ADHD, that they may have this problem, as I discuss in my books on taking charge of ADHD, is that they begin to hear from other people around that child, relatives, preschool teachers, regular teachers, coaches, others, that their child is unusually inattentive, easily distracted, very impulsive and risk-taking, almost heedless and not considering the implications and consequences of what they're about to do. In many cases, though not all, particularly for girls, there may be some hyperactivity and busyness and, kind of driven by a motor quality to that, but that's not always there. And then, of course, there is the disinhibition, the impulsiveness that we see, where they act on things, they blurt out, they interrupt others. They also display problems with emotional impulsiveness, not mood disorders or bizarre emotion, but just very quick to react to other things without showing a more emotional intelligence or maturity that someone of their age should be demonstrating. So if you start to hear those kinds of complaints from others, if you have other people say, I don't want your child at my house anymore, you can't play in our yard, your child's been, asked to leave this preschool, or your child's being referred for some kind of special services at school, the minute the environment starts kicking back, as I call it, and giving you feedback about this, you have to take that seriously, because that is beyond what we see in typical children. And you can't just write that off to high energy or busy kids and so on. So, listen to that. And I often find that moms in particular get it before anybody else does, even before pediatricians do. They're dialed in to those kids and they said, look, there's just something that we have to deal with here, because I'm hearing all this feedback in various forms that my child is having difficulties. Take that seriously. Don't dismiss it. And if the pediatrician does, then ask for a referral to a specialist, and don't just buy that, because pediatricians are often wrong when they first hear mothers complain about their children's behavior.
I think you just took me down memory lane, Russ, because everything you just said there sounded like all of my report cards in elementary school. Very destructive in class, tries to be the class clown, doesn't listen. I mean, all the things that you mentioned, I can look back. I had boundless amounts of energy. I had no ability to focus, or I was hyper focused on one thing, whether it be like hockey. If I was a goalie in hockey. Mm-hmm. So I was able to really hyper focus on a passion like that.
Sure.
Obviously, we had no idea back then. That was 40 years ago.
No, we didn't.
I think that in my life, and I want to say in the last 10 or 15 years that since I've been starting and I was doing a lot of cognitive behavioral therapy, that it's really changed my self-regulation, my self-awareness. I can now look at, give you an example. I took an ADHD test just the other day, and I took it as two different people. I took it as myself when I was 8 years old or 10 years old, and then wildly ADHD. And then I took it as 49-year-old Chuck Bastie,
Yeah.
and it said, you may not have ADHD. So my question is it possible, and you and I spoke about this on Wednesday, but is it possible that this is a very treatable disorder, and how does that work?
Yeah, it's a highly treatable disorder. But first, let me point out that there are no real tests for ADHD, and the ones that are out there, which tend to be neuropsychological tests of one sort or another, are better for children than for adults. They really lose their sensitivity to detecting the disorder. So at this point, I don't want people to rely on testing because it's not very accurate. But what we do know is that those with ADHD are going to continue to have these difficulties for quite some time. And, as you and I discussed, even though maybe 14%, up to 35%, but I think that's an overestimate, of people may actually outgrow ADHD by their 30s, the vast majority do not really outgrow the symptoms or the impairment. They could outgrow the diagnostic criteria, but that's because they're mainly based on children, and they're not really well adapted to detecting adult ADHD. So don't let that fool you. I mean, you could outgrow the diagnosis, as you've already mentioned quite nicely, and yet still remain symptomatic and possibly impaired. And once you're impaired, that's, of course, the demarcation for what constitutes a disorder. So I want to emphasize, again, that there's no test for this. It's based on your history, your presenting complaints, the differential diagnostic ability and knowledge of the clinician you're seeing. All of that has to come together along with your rating scales and your archival records of your schooling and other things to pull this together and make that diagnosis. But there is about a 1 in 6 to 1 in 7 chance that you could completely outgrow this after about 30 years. But we don't want to count on that because most people don't.
You mentioned adult ADHD, so I wanted to try to get into a context of what some people can actually identify in their own life. So I was in a relationship with a woman who was, now I can see it now. I didn't know what it was before. I just thought she was, I use words like whack job, had no integrity, flaky, had zero time management, was always late for everything, canceled on everything at a whim. Like everything was completely so significant to her in every area of life, couldn't manage any area of life. Her kids were absolutely overwhelmed with everything. One of her sons had ODD as well, and it was like a really overwhelming experience for her. And on my side, I felt really bad for her. Yeah. And I didn't know how to deal with that. So in adult ADHD relationships, what are some of the things that you can do as adults to really be able to, give them space and be able to give them structures in order to help those relationships out?
Well, there's an awful lot that you can do. And I talk about, almost 100 things that you can do to help adults with ADHD in my book on taking charge of adult ADHD. But, and we don't have time to go into all of that. But I want to emphasize, in adult ADHD, you're looking for things that seem to be qualitatively different than what we see in the kids. They're not, of course, but this is what you're going to see in an adult with ADHD. You're not going to see hyperactivity. They're not climbing on furniture and sliding down banisters and, driven by a motor. So that's all pretty much, if it hasn't resolved, it's quite minimal. Instead, what you see are, first of all, as we said, problems with self-awareness. They don't seem to be as aware of how much difficulty they're having with their behavior and with others. And that makes for a problem in relationships, particularly intimate relationships, as you mentioned. The second thing is that they're very impulsive. So they don't think through their decisions. They make them on impulse, which if you're on vacation is kind of fun, but you can't live your life on vacation. The bills have to be paid, children have to be raised, jobs have to be dealt with. And all of these responsibilities, the scut work of life, kind of gets in the way, and they really struggle with that. With the mundane aspects of life that are very important to deal with. On top of that, they're often emotionally impulsive, so they react to things very quickly. They can become aggressive, they can become angry or impatient or easily frustrated. Again, especially in intimate relationships with others. This is not a mood disorder. It's not like mania or bipolar where it's bizarre, irrational, capricious, and nobody knows why you feel the way you do for the last 3 weeks of your life. No, this is just in the situation, very reactive to that situation in their emotions. They often have very serious motivational problems. They procrastinate, can't start things, they start them, can't finish them. Their life is filled with uncompleted projects all around them, which leads them to be demoralized and leads other people to be very disheartened, and disenchanted with them. And then, of course, they have a lot of trouble with planning and problem solving. So when they set a goal and they say, I'm going to do this, and that all sounds very sincere, which it is, the likelihood of them succeeding and following through on these longer term goals is pretty much zero, because that requires sustained doggedness and determination and self-motivation, that drive to get that done. And that stick-to-itiveness is very, very hard for them. So if you're living with somebody like that, that's adult ADHD, and that's very hard to live with, because you feel like you're living, I don't mean to be pejorative, but you feel like you're living with another child, and you have to become their frontal lobe, their executive brain, in order to put structure around them and help them get to where they're going, which is great if you have the patience to do that. But first, you have to acknowledge that your partner has a neurodevelopmental disorder, and that leads you to have compassion for them. If you haven't made that first connection, that they have a disorder, you're just going to be angry and judgmental and ready to bolt from that relationship, because it's like, what have I gotten myself into here? I don't need another child. I'm good here. So think about those areas of deficiencies. Are you living with somebody or dealing with somebody like that? Then that's probably an adult with ADHD.
And I mean, everything that you said was just so spot on. And I'm almost laughing at myself right now for not being able to recognize this. So if I seem like I'm, laughing, I'm not laughing at you. I'm laughing at me.
Or near me, at least.
Or laughing near you. Yeah. One of the things I wanted to ask you is obviously there's very, very difficult behavior to deal with, even if you do know that the person that you loved has ADHD. I'll give you an example. I had an acquaintance friend of mine that was just wildly ADHD. He was actually on Adderall, on healthy doses every single day. And yet I would have conversations ad nauseum. Please do not open my door without knocking first. You don't come in. Let me know who you're there with. You can't come downstairs. Whatever it was, and he would just, in my eyes, would never listen.
Yeah.
And now I can see that, he wasn't unwilling to do that. He was just unable to do that, and his executive function was impaired. How do you deal with people who have that sort of high level impairment where they're apologetic, that that they don't have a bad bone in their body? They're not trying to be diabolically, mean to you, but they're just unable to do the things that you've asked them to do time and time again, and still have patience with them.
No, I mean, it's very challenging to deal with that. I think the key to coping with that, number one, is recognizing that there really is a disorder here. This isn't a life choice or lifestyle. It's not something that you're going to wake up tomorrow and smell the coffee and make a decision that's different from that. So to me, these people who behave like Kramer and Seinfeld, who just sort of barge in on your life, sliding in the door, very dramatic and and emotional and demanding of your time and attention. Adults with ADHD can be like that. But if you understand that this is really who they are at their core, this really is a neurodevelopmental disorder, first of all, it moves you from the framework of moral judgment and denigration of them over to the area of science and compassion. This person really does have a difficulty, and they're not responding to the feedback that you've given them. So very quickly, Chuck, I know you've asked what we can do. There are 5 components to dealing with ADHD in children and adults. Number one is diagnosis with the information that comes along with that. So get properly diagnosed by a well-qualified mental health professional so that we know what we're dealing with here. And 85% of people with ADHD have at least a second mental health disorder, whether it's oppositional disorder, whether it's substance use, whether it's anxiety or depression. There are a number of disorders that go with ADHD, and many of them may be present. So we got to deal with that as well. So diagnosis is number one. Number two, learn. learn about your disorder as much as you can. And truth is an assembled thing. So don't rely on one source. You need to go to the major websites put out there by the charitable organizations in Canada. That's CADRA.ca, CADDRA.ca. In the US, it's CHADD, CHADD.org. These are our foundations that have evidence-based, unbiased information about ADHD. There are others out there as well, but I would start with those. So get yourself educated, become as much of an expert, read widely, and understand your condition. And then 3, 4, and 5 are the major treatments we talk about. Medication for 70 to 80% of the people with the disorder, they're going to need that. On top of that, behavior modification, we're talking about cognitive behavior therapy, adult ADHD coaching, maybe some mindfulness meditation training going on with those other 2. So learning how to cope with and modify your symptoms. Number 3, accommodations. How do I alter my life, my workspace, my home, so that I'm not as disabled by this disorder as I might otherwise be? You put those 5 things together, you're doing a pretty good job in dealing with this.
You've given me so many different places to segue this right now, and I've had a week to put out, I guess, a consensus from my Facebook following, and to have you on the show today. Almost all the questions I've been asked to ask you revolves around medication.
Yeah.
Before we get to medication, I wanted to start by segueing the medication portion with anything that's on an EEG side or a brain scan side. What do we know about the brain under the scope, so to speak? Can we find out the information of what your prefrontal cortex is doing under stress, or what's the information or the science behind what we can understand from looking under the scope of the brain?
Yeah, good question, Chuck. Thank you. Here it helps to distinguish between 2 areas of practice and knowledge. There's the research, which is done on groups of people with ADHD. So let's say I take 250 kids with ADHD, 250 typical kids. We follow them for 10 years. We scan their brains using, MRI or fMRI, and we can plot the degree of delay that's due to the disorder. So I'm studying groups. On the other hand, that doesn't mean that measurement, that MRI, is going to be valuable for diagnosing an individual, because we're averaging together those 250 people to see the mean differences between them and typical people. Those mean differences could easily be significant, but it doesn't mean that they're useful for diagnosing a person, because if I look at one scan, the differences between a typical and an ADHD person are very subtle. They're not going to show up. There's no hole in the brain. There's no missing hemisphere. There's no plaque in the brain like dementia that I can key in on. So, what makes this very frustrating is, while these measures you mentioned, EEG, MRI, SPECT, blood flow, are useful in research and studying groups of people because we average them, are not at all useful in diagnosing an individual with the disorder. And by the way, that applies to genetics as well. So please don't go to commercial genetic sites, that are going to tell you that they can, spot psychiatric or mental health or, even health problems. They're not that reliable for mental health disorders. And as a result, we can come back to the point I made earlier. There is no clinical test for ADHD that is valid enough for use with individuals in clinical practice, even if it is valuable in studying large groups of people that we can average together and look for these mean differences. So yes, the measurements are very helpful for research purposes and clearly show that ADHD is in the brain. We know at least 5 structures in the brain that are implicated. They're linked up in various networks that lead to the ADHD symptoms. This is where the medications show their biggest impact when they take them. I mean, all of this is very well validated, but it doesn't mean that an individual should call a doctor and ask to have these tests done, because if you do, you're going to pay a lot of money and you'll be very disappointed in the results. And whatever you hear is probably not valid anyway.
One of the biggest topics, if not the biggest topic that I get, and I just prefaced this before, is the concept of medication. So obviously there's Adderall, there's a host of other treatments that they have through medical science nowadays to treat the symptoms of ADHD. in order to get the patient back to zero or be back to grounded, in order to have them be regulated, I guess. Every parent in the world, I find there's a split right down the middle.
Yeah.
Some parents swear beside medication because they say it's, giving them their kid back.
Right.
And then there's other parents that are screaming big pharma. We're not treating the disease, we're treating patients. And there's a conspiracy theory out there about big pharma trying to treat the disease. So that way you are always having a client, that there's big money behind that. So what is your view on medication, and how can parents get that information out there so that way it actually serves their peace of mind?
Sure, Chuck. Well, let me just acknowledge 2 points right up front. Number one is that it's very appropriate for both a parent of a child with ADHD and an adult with ADHD to be a little reluctant to be taking a prescription medication that has very powerful effects on brain functioning. And I get that. And we want you to ask questions. We want you to read widely. We want you to understand the positive and the negative benefits, the risk-benefit ratio. All of that is very rational. But at the end of the day, our research clearly shows that there are no treatments that are as good as our medications. None. Not psychology, not cognitive therapy, not nutrition, not supplements. Nothing beats the medication. And I'm a psychologist, and I'm telling you that. So out of reality, the evidence is very clear. Now, that doesn't mean we use medication alone. That's not responsible. Some people can get by with only medication, good for them. Other people, and most people, are going to need a combination of interventions, psychological, social, educational, with that medication. But if you do head-to-head comparisons, the medications are 2 to 3 times more effective than anything else on the planet at the moment. So don't let anybody tell you they've got something as good as medication, because that's a lie. And you should walk the other way. And if they tell you their treatment has no side effects, that's also a lie, because one of the clear signs that you have a sham therapy is when somebody tells you it produces no side effects in anybody. That's not possible. Given human variation, given variation in clinical practice, there are going to be problems with implementing a truly effective therapy. Now, all of that said, we also have to keep in mind that the medication doesn't solve all the problems. In about half of the people, it does normalize their behavior, and they might be able to get by with that and some of the additional accommodations that are out there. There are others, the other 50%, where we're going to see marked improvement in many of those people, but not normalization. They're going to need even more assistance and systematic help. And then there's about maybe 3 to 10% of people who simply can't tolerate the medication or simply don't respond to any of them out there. And those are the people where we're going to have to cobble together the non-medical interventions. And so, there's this range of response to medicine. It's not God's gift to treatment for everybody, but for some people, it clearly is the best thing we have. Now, as you pointed out, there are also going to be people who are reluctant to engage the medicine. They've heard from the media about all the evils of medication. First of all, understand that our media is no longer presenting the science, the knowledge, the unbiased. All of our media, yours and mine, are now into sensationalism and very biased reporting. So, man, if you're hearing this on television or even in a major newspaper like yours or ours, let me tell you, they are looking for the underbelly of the story as clickbait and in order to sell subscriptions. So, we've long ago left this idea that journalism is presenting a balanced view of our lives, and particularly with regard to these medications. That doesn't let the pharma companies off the hook, because frankly, although they have good products and they're well tested, and down here they're FDA approved, the fact is that pharma's in business to make a profit for their shareholders, and sometimes they can get ahead of themselves, over their skis, so to speak, in promoting the benefits of their medication. So when you combine that with the fact that ADHD is more widely recognized, we have support groups in Canada and the US that are promoting awareness. On top of that, we're also recognizing ADHD in adults, in women, in girls. All of those conspire to increase our awareness of ADHD and our use of ADHD medications. But I understand the reluctance to use medication. You should be reluctant to use a prescription drug. You need to be convinced it's necessary, but you shouldn't just get all of your information from the trade media, because it's often wrong when it comes to these medications and this disorder. You need to seek out those charities and foundations we mentioned to get more accurate evidence-based information. And when you do, I think you'll make a reasoned and informed decision about what's right for you or your child.
I don't even think that was physically possible for you to answer that more perfectly. Like I'm gonna say that your back was slightly arched on the dismount, and you stuck the landing. So I'm gonna give that a 9.5 overall.
Yeah,
you're not a
what
Nadia Comaneci.
Oh man.
Yeah, you're not. You don't pull off the Nadia. You don't get the perfect 10 or
I'm
less. But
sorry. I was looking for
I
a
mean,
10 there, but I had 44 years of my life. What do you want?
I mean, you
Plus, it's in
hammered
my
every
family.
single
We
point.
talked about this last week. This is not just professional for me. I've got relatives, I've got friends who've suffered with this. I've lost family members to car accidents and suicide with this disorder. So it's not just professional. If there's a passion here, it's personal to me. That we get this information out there to help people and to get it right.
I said this to you last week, and I hope nobody takes this the wrong way, but I'm a bit of a skeptic in terms of age or ageism. And in my generation, I just don't think that someone who's older than me at 50 right now should have the awareness or the compassion or the empathy that you have as a default way of being, because you were educated in a time where there was a whole lack of empathy and lack of compassion and blaming. And I mean, every parent out there right now, one of the things I love about your YouTube content, that you're speaking to the crowd of people, is like you tell them that you're never going to speak down to them and you're not going to condescend them. And just like you just answered that last question as well, I wanted you to explain to parents why this isn't their fault. And I want to talk to you about the parent shaming and the amount of frustration and guilt and humiliation and blame that they put on themselves for the behavior of their child. Whether I always liken this to, when dogs are in a park together, we get more upset about how our dog reacts to another person by blaming the dog, when that really is how we treat our kids on the internal basis of what we suffer from, of embarrassment or guilt, or being called into a parent-teacher meeting and saying your son's a disaster or your daughter's, chaos and disturbing the entire class. Can you speak to the parents a little bit about why this isn't their fault and how they can rid themselves of that stigma?
Yeah, sure. What a great question, Chuck. Because I grew up with I had a fraternal twin brother with ADHD, and I grew up at a time in the 50s when ADHD was completely unrecognized, and at that time, my brother's problems were being blamed on my parents, my mother, my father being in the military, the fact that we were moving every year or two because of his career. There was always this blame on the environment. It was very similar to what we did to autism back in the 1930s to 1950s, where we blame mothers as being unaffectionate and cold. We called them refrigerator mommies. And basically, in an act of what turned out to be cruelty, we were blaming them for what turned out to be a highly genetic neurodevelopmental disorder. And we were doing that for ADHD and still do to some extent, where autism has been admitted into the fold of neurogenetic disorders that are biological, and nobody, at least in their right mind, should be blaming families for causing autism. We are happy to blame families for causing ADHD. And, and it's not just society that does that views all problems of child behavior as stemming from bad parenting. It's parents who do that as well, because they bought into the same cultural zeitgeist, or the same unquestioned assumption that child behavior is always the result of the rearing environment. And that is absolutely false. To some extent, there are issues in behavior that are related to the rearing environment, but not neurodevelopmental disabilities. And so parents need to give up that yoke, that albatross around their neck, because you didn't cause this. I mean, unless you're going to take responsibility for your genetics, you didn't create this disorder in this child. You have been blessed with a special needs child. And you're going to have to deal with that, just like we have to deal with, we have an ASD grandson in my family now, and we have to cope with that and make arrangements for that. We have, ADHD in families as well. So number one, you didn't cause this, give up the guilt. Number two, I'm putting you back on the hook because now you are a caregiver, a shepherd to a neurodisabled child who needs all the help and advocacy you are willing to give them. So, stop blaming yourself and feeling so bad about what you think you did wrong. You didn't. On the other hand, let's own this. Let's step up and advocate for these children and what they need, because it's not their fault either. And it's not your fault. It's just what is. Let's deal with this. And then we can get on with creating as meaningful and as high a quality of life for these children and adults as possible. I wish that had been done for my brother. It wasn't. Unfortunately, he passed away in his 50s because of his recklessness in a car accident. And subsequently, one of his children committed suicide as a result of their impulsivity. So, I'm trying to prevent that from happening in other families. And the only way is to take all this evidence we have and get it out to the people who need it. Chuck, I review all research published on ADHD in the world every week. So, there are very few people in this world that know that research base the way I and many of my colleagues who I share these findings with are aware of. And once you know that, you give up the guilt and you get out there and you advocate for these people as having this neurodevelopmental disorder. And then we can really provide help to them.
I'm going to take a couple questions on the side, and I will do that. But before I forget my question, before I forget it, and then I'll go to defer to the questions. How do you approach parents that you can identify ADHD in their kids? Say, for example, I coach hockey.
Yeah.
And I can now see it, and through a lens of education and understanding now. How do you approach parents that are not open to that? What are the conversations that you can slide into that conversation inside a place of love or understanding or empathy for what their child is going through, and more important, what the parent is experiencing, to be able to show them where there is help available or what you're noticing without hurting their feelings?
Yeah. Well, indeed, a good point. Because, it's a very touchy subject, I mean, we don't want to be telling people their children have problems when they don't. But at the same time, if we're coaches or teachers or, people in positions of responsibility for children, we do have a responsibility to let parents know when we're seeing something that is beyond the typical range of diversity that we see in child behavior. And so I approach it, and I suggest other people approach it that way, that you come to a parent and you say, look, children vary widely in their behavior, their personality, their level of risk-taking, and their emotional maturity. And I see that. And just say, as a coach, I see that. I've, coached or I've taught hundreds or thousands of children in my career. But there reaches a point where these behaviors that we're talking about as part of neurodiversity begin to cause harm to your child. They begin to result in negative consequences. The environment starts kicking back. They're losing friends. They're not getting, ice time. They're not being allowed into the league. They're not being able to, be in regular education. They're being referred for special needs assistance. There may be in a private school being kicked out of preschool or that private school. Other people in your neighborhood don't want your child playing with their child. Coaches of other sports have already told you this child is very difficult for us to handle. Please don't bring him back, to our sports league, whether it's soccer or, American football or what have you. So I approach parents and say, look, I get that we have this wide range of typical child behavior, and it's quite broad. But the minute it starts causing harm to your child, and I see that harm, and I see the reaction of others to your child, I need to let you know, as part of my obligation, as part of my responsibility. What you do with this is up to you. Hopefully, you will seek out the counsel of your primary care physician, your pediatrician, or maybe a mental health provider to find out what this is all about. Because I don't know that. I admit, as a coach, I don't know about all the range of mental disorders. What I do know is your child is hurting and suffering, and we need to own that and try to do something about that. So, admit your ignorance up to some extent, but accept your responsibility to share that feedback with them in an open and honest and genuine way, not accusatory, not judgmental, not what the hell did you do to this child to create these problems we're having in hockey practice, because that is totally counterproductive. But in a very open, supportive, and compassionate way. And if you have children, even admit that and just say, look, if it were me, I would want to know if my child is struggling with the other kids, with their relationships, and so on. And just share that back with you as to, what can you do with that information. And I think you're being genuine, you're being honest and open with them. And if they're still going to react in a closed-minded, negative way, well, you've done your job. You've handled your responsibilities, but at least you did that. And don't pass over it. Don't shut up. Don't ignore it. Because you do, as a coach or a teacher or a mentor, have a responsibility here to let parents know if something's going wrong.
I want to poke you to see if you're real, because you're just too fantastic right now for me to comprehend. I'm trying to stay in the moment and be the interview guy, but I'm just like, yes, damn it, what he just said, yes, just like that. Like, why didn't I think of that? Something like that. Okay, I could be selfish all night. Yeah, I could be selfish all night and keep you to myself, and I'm going to actually share you with my guests as well. So there's a wonderful question from my friend Kareem. She says, I would be curious on what steps to take to motivate a child to decide on their next steps after high school graduation. So I guess what I'm taking from this is the word motivate to inspire. Is there a possibility that you can use either one of those mediums?
Okay, first of all, let's understand that most ADHD children do not go on after high school for advanced education, like a 4-year college or professional degree or something. Some do, and they're capable of doing it. Most don't. So first of all, pat yourself on the back, because if you got this kid through high school, a third of these kids do not finish high school unless there are special services already identified and they're diagnosed within the school system. So, kudos to you that this kid has gotten this far. That's wonderful. Second, what are your child's unique aptitudes, strengths, non-traditional abilities? Would you stop thinking in this linear, one-channel mode of success, that it's all about education, advanced education, high school, college, graduate school, doctor, lawyer, blah, blah, blah. That's a very narrow slice of adult human life. There are many roads to Rome, many routes to success, often non-traditional, and you're going to have to be looking at the non-traditional, because very few ADHD children really succeed through those traditional routes the way other children might be able to do. I'm not saying they can't, and if they can and they have the ability and their aptitude happens to be in those areas, well then, damn it, go for it. But I want to encourage most parents to think outside the box here about, what does my child do well? Google ADHD success stories. Look at Simone Biles. Look at Michael Phelps. Look at Adam Levine. Look at Justin Timberlake. Look at the professional athletes. Look at the chefs. Look at Ty Pennington and Glenn Beck and all these other people who have succeeded despite being ADHD and succeeded in non-traditional pathways of success. So whether it's athletics, videography, entrepreneurship, owning your own business, starting Virgin Atlantic Records and airlines like Richard Branson did, or JetBlue, or, Adam Levine, which is a whole industry into himself beyond Maroon 5. There are just so many success stories where families didn't pursue the traditional path to success, but saw this sparkle of genius and aptitude, went out and found community resources to promote that aptitude, whether it was in software programming or IT or being an entrepreneur or starting a pizza chain or a car wash or, playing guitar, whatever it was. They saw that. You look at the history of these success stories, and behind that, there was a mother or father who supported this kid to the hilt, who got the area resources to promote that non-traditional pathway, who were unconditional sources of safety nets for these kids and believed in them, and you will see success stories. So it isn't always about school, education, degrees. There are many ways. Indeed, the fastest way to make $1 million is to own a car wash or a pizza delivery service. Did you know that? I mean, it's not being a doctor or a lawyer, or something like that. So, you can own your own plumbing business, or be a home builder, or have a landscape service, or become an entrepreneur, or be Richard Branson, and do it through non-traditional pathways. It's often a rocky road. Let's face it. I mean, there are going to be difficulties. Michael Phelps had a number of DUIs. Adam Levine had some struggles before he went back on medication. Justin Timberlake talks about his struggles early in his career. Ty Pennington on America's Extreme Home Makeover also has some DUIs and substance use problems that he owns, as well. But, despite those struggles, their families were there for them and recognized that aptitude that wasn't always traditional. So, I know I've run a little bit longer here, as professors are likely to do, but this is an extraordinary point for me, because more children with ADHD could be and could have been successful if people had thought outside that box and looked at the range of success stories in non-traditional pathways. And good for the parents who do that.
You said something in your YouTube video as well that really stuck with me, and even in my concussed brain memory problems that I have, you said that every single ADHD kid has a gift, a highly evolved gift, and every single person I could think of who has ADHD in my life that I've known or I have known, I could tell you one charismatic, amazing thing about that person that everybody points into. The second thing about that is find the gift. The second thing was find a coach or a counselor or a mentor behind that driving factor. Right. And the third thing was to get diagnosed. And I think you brought that up really nicely.
Yes.
But I wanted to give that as a caveat to parents as well. So that way we speak all the things about the ill effects of ADHD, but we don't mention the gift side of ADHD and all the charisma, all the gifts, all the imagination, everything else that comes along with that. My friend Sarah, who's been a wonderful friend of mine, she chimes in. I'm going to read this. Diagnosed at 46 and treated with Adderall, and it made an overnight difference. Now at 51, it seems to be back with a vengeance. Would menopause and the lack of estrogen play a role in a drop in dopamine?
Absolutely. And indeed, how timely is this? This morning, I just read and approved for publication in my newsletter, the ADHD report, which goes out to clinicians and libraries throughout the world, but about 8 times a year. But there's an article by Jeanette Wasserstein and her colleagues that deals with this head on. She reviews the research on ADHD in women, and particularly the role of these sex-related hormones in ADHD, and there clearly is a role there. So to answer her question, first of all, yes, changes in the balance of estrogen and progesterone clearly make a difference in how symptomatic you're going to be, both at different times during your menstrual cycle, also at different times in your life, both as a teenager, when as a girl you're starting your menses, and in later life as you are entering perimenopause. And menopause, that balance in women does play a detrimental effect in increasing your ADHD symptoms. So whereas you may have been marginally ADHD or mildly ADHD as you approach menopause, you may now move into more moderate ADHD, both because of natural aging of the brain, but also because of these radical changes that are taking place in these sex-based hormones. So she is spot on with that question, which is why ADHD in women is somewhat different. Not, qualitatively grossly different, but somewhat different than it is in boys. It's why we recognize it in the boys earlier than we do in the girls. It's why there's a second wave of ADHD onset and diagnosis in girls in adolescence as they start their menses. It's why we also see a third wave of adult ADHD in women as they're entering perimenopause, and we don't see that in the guys. So she's absolutely right. And clinicians, as Jeanette and her colleagues argued in this article, need to be more sensitive to where women are in their hormone cycles, in their life, and take that into account when they're understanding, eruptions in ADHD symptoms worsening. Maybe the drug response isn't quite as good at a certain time of the month or a certain time of life as it was earlier, and make the adjustments to the treatment plan based on knowledge of the estrogen progesterone cycles in women. That's going to be a much more nuanced approach to dealing with ADHD in women than we've had previously. But I love the question because it opens up truly a cutting edge issue in the science of ADHD in girls and women.
Okay, so we're getting close to the end of the hour. I'm going to try and keep this a little bit after the 8 o'clock time that I promise you. If I can be a little selfish and go like 10 minutes over, but I wanted to talk about trauma with ADHD because this is something that's obviously a big topic in the neuroscience and the effect on the brain, especially the prefrontal cortex, with decision making. And obviously, when you add layers of trauma to people who don't have ADHD, it obviously adversely affects their decision-making process.
Yeah.
So when you're dealing with a brain that is predisposed to ADHD, and then you add layers of trauma on that, what does that look like from your standpoint as far as a diagnosis, or what behavioral patterns will differ because of the ADHD? I know that you mentioned at the start of the show that most people who have ADHD also have a second diagnosis, either bipolar or borderline or one of the cluster Bs, for example, inside of that. But what does trauma add to ADHD, and how can we mitigate more of that by treating the trauma?
Yeah, that's it's an incredibly complex question. So what I want to do is I'm going to oversimplify, but let me split it into two issues. There's physical trauma to the head, the brain, as in closed head trauma, repeated head injuries, and so on, but also the more neurological problems of tumors and strokes and epilepsy and so on. So
let's take the emotional trauma,
and then there's emotional trauma.
Yeah,
so let me start with the brain trauma. We know that ADHD can arise solely from repeated head injury. Anywhere up to 5 or 6 years, though usually within 9 months after the traumatic injury occurs. So you can be a typical person, experience a closed head trauma, particularly repeated closed head trauma, as you might do in sports or boxing or hockey and so on. And that can lead you to develop ADHD. So there's an acquired form of ADHD that we see out there. The second thing is that let's start with people with ADHD who have the genetic type of the disorder. They are more risk-taking. They're also more prone to enter sports and extreme sports and take risks. So for all these reasons, including their bad driving and so on, they're going to be more exposed to trauma. So what's that going to do? Head trauma is going to worsen the ADHD they already had. And so there's an interaction here between you had ADHD, it led you to take those risks, you've gotten bonked on the head a few times, your ADHD is worse because of it. So we see that going on as well, an interaction of these two. So there's no question that physical trauma to the brain, particularly closed head trauma and the frontal lobe, can lead to an ADHD-like syndrome. Now that said, let's move over to emotional trauma. All right, here what we see is that there's very little evidence that early emotional trauma creates ADHD as a byproduct. It certainly creates PTSD, anxiety, demoralization, depression, hypervigilance, and all the things that go with PTSD. But we don't have evidence that in and of itself, emotional abuse. Now, keep in mind, emotional abuse usually accompanies physical abuse. You may have been slapped about the head, or punched or hit in the head. That's closed head trauma. That's a different issue. But just emotional abuse, in and of itself, doesn't seem to lead to an ADHD syndrome. It can lead to all the other things I've mentioned, as well as oppositional behavior. Now, on top of that, all right, people who are likely to abuse you are going to be your relatives. And the people who are likely to abuse you are more likely to have ADHD. So you've got adults with ADHD often raising children with ADHD, creating environments in which emotional trauma, victimization, stress, and chronic and repeated disadvantages are occurring to you. That's the ADHD leading to an environment that is emotionally traumatic, which then leads you to develop your anxiety, PTSD, depression, but it isn't necessarily going to make your ADHD, blossom where it wasn't there before, or necessarily be worse. But there's no question that people with ADHD often live in much more stressful and emotionally traumatic environments, partly because of their ADHD being very stressful to deal with. Let me tell you, there's nothing more stressful than raising a child with ADHD, except maybe a child on the autism spectrum. And then you've got, of course, the fact that a third of these parents have the same disorder, often undiagnosed, and the parents are creating a more disruptive, dysregulated, emotional, chaotic environment that often has more emotionally traumatic events in it. So, there's a huge chicken and egg problem here as to which comes first. But when we sort it out, it doesn't look like emotional trauma in and of itself causes ADHD, but is certainly associated with it, both in the child and the parent.
Oh God, you're blowing my mind right there. I want to ask for the people who've asked me in relationships with partners with ADHD in intimate relationships. Generally speaking, what I find is that females with ADHD, because of the chaos, because of the hyper impulsive behavior, because of the energy levels, they tend to go with more partners that are more aligned financially with containment and security. On the other side, and I'm generalizing with this, on the other side, I found that most males who are ADHD tend to choose partners of women that are structured, planned, can look ahead, have vision, can partner with them to get the gift of their ADHD, but to structure them. Certainly, I was like that with my wife. I had periods of time where I made $200,000-300,000 a year, and before and after her, I've never made that money ever since. And I always tell people that she was the only reason why I made that kind of money, because at that time, she was absolutely everything that I needed to be uber successful that I wasn't, or incapable of doing. And I know I was incapable of doing it. And even after she left, I proved it that I was incapable of doing it, because I went right back to that platform. But talk to us a little bit about people who are in relationships with a dynamic of a person with ADHD and how they can manage that inside that partnership.
Yeah. Well, truly, this can be very important to the outcome of somebody with ADHD, because both, in Canada, Lily Heckman and Gabrielle Weiss, who have one of the longest running longitudinal studies in the world, and one of the first longitudinal studies was done up there in Canada, in Montreal. They found it. I found it in my subsequent Milwaukee longitudinal study, where I followed people for over 25 years as well. And if you talk to people who do this follow-up research into adulthood, all of us will tell you that one of the factors that determine how well our kids turned out, apart from, education, intelligence, family resources, blah, 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 the usual litany of things. But one of the big factors was, who did you partner with, both as close friends in your life and as an intimate partner? If you chose somebody and they chose you, who was very well organized, almost obsessive, great time management, very conscientious, and who had compassion for you and was willing to help organize you, as you discovered, you can be a huge success with a partner who gets you and understands your issues and helps to compensate you and tries to make you the best person that you can be. And of course, you need to do the same thing for them. Let's not overlook that issue as well. They need your support too. But that said, we can also find that people in our studies who opted for people of similar traits, and there is what we call non-random mating in ADHD, where people with ADHD are more likely to choose people with another disorder, including ADHD. Well, that just creates a downward spiral in that intimate relationship, where you're going to be a lot worse off than you were if you hadn't chosen them as a friend or as an intimate partner. So yes, the person you choose to be with and the people you choose to surround yourself with have a huge impact on your success in your life and your coping with ADHD. So that said, the questioner is quite right about that. But I also want to point out a couple of things that generally the public doesn't know about with ADHD. First of all, adult women with ADHD are more likely to fall prey to victimization, particularly sexual abuse and victimization within relationships, both within their families and their extended relatives, with strangers, but especially as they become adults with intimate partners. We don't see that with the males, but we do see it with the females. So women with ADHD need to be particularly vigilant about who they're surrounding themselves with, because of their own difficulties with self-control and impulsivity, as well as a predisposition to overuse alcohol and marijuana. They set themselves up for a sexual and emotional victimization. We also know that adult ADHD is the biggest predictor of intimate partner violence within adult relationships because of this emotional dysregulation that they have. And that's true of both men and women, becoming more reactively aggressive, easily frustrated, and impatient in these relationships. So, yet more reasons for people to get treated, get the combination of medication with these other services, and try to limit these external risks and these secondary harms that come from unmanaged ADHD, because you're putting yourself in situations where if you'd known that they were part of your ADHD, you might have chosen to do otherwise instead of partnering with that person, or taking that extra couple of drinks at the bar and going out with somebody and hooking up with a stranger. Women with ADHD in particular have to be very, very vigilant about who they're surrounding themselves with. So thank you for asking that, because that is a very undeveloped and I think unwritten about aspect of adult ADHD that really goes a long way, I think, to helping people understand and prevent victimization.
So well said. Before we go, I just wanted to try and pick your brain for people who have been listening so far, identify with what you said.
Yeah.
I've got a lot of comments on my phone that have come through saying, thank you, kiss him for me. He's amazing. So I don't know if you're sure if you're single or not, and if you're looking for a Canadian girlfriend, but there's a tribe out there, Russ, I'm telling you.
Thanks.
Let's talk about structures, about what we can leave with people after the call today, where they can actually hear what you said, they've identified it, they can see where this pattern is perpetuating. They don't want to go down that road, like you said. Right. But what are some structures that we can give people outside of your books and obviously your YouTube channels, which cover all this, but some really brief moments that people can cover, some structures which will help them immediately?
Sure. Well, we'll go back to the big 5 interventions I talked about. Diagnosis, get educated, get on medication if it seems appropriate to you. About 80% of people need it. Obviously, get some behavior modification programs going, either through cognitive behavior therapy for your executive deficits or adult ADHD coaching, or both. Finally, read these books that you mentioned and others on how do I change my environment so that I'm not as impaired from my disorder as I might ordinarily be. You and I talked about this last week. It might be that you're prone to internet gaming or social media. Okay, well, all of those apps are on a separate computer kept out in your kitchen or on your back porch or wherever your comfort space is. But in your workspace, either on the job or in your home office these days in the pandemic, that computer has none of that on it. You've built in all those timers you can download into Google and others that block your ability to access, these other non-work related channels on YouTube or on the internet. So, that's you haven't treated your ADHD. What you've done is reorganize your environment because of your ADHD and in order to cope with that ADHD better. So those are things that you can do. In addition to that, one of the unwritten aspects of ADHD that hardly anybody talks about until recently, though I've been talking about it for almost 20 years, is ADHD causes time blindness. You can't deal with time and time management as well as other people. There is no disorder in psychiatry as bad as ADHD when it comes to the dimension of time in our life. And yet the older we get, as we grow up, the more time sensitive everything in life is becoming. And it's part of the reason that although ADHD symptoms might be declining somewhat with age, impairment is going up with age because life is becoming more and more time regulated. And you don't get that. The part of the brain that deals with time and timing is very deficient in ADHD. But once you understand that, you will start to surround yourself with devices and other things that externalize your time sense so that you're using your calendar and your Outlook calendar and your Google calendar. And you've programmed your phone to trigger you, hopefully, with notifications when things are due. You've got a cooking timer set on your desk for that 20 or 30 or how many minutes you need to get this particular project done. You've also asked other people around you, and you've committed to them, look, within an hour, I really want to get this done. I'll check back with you. We know that we're more likely to follow through on things in a temporal way if we commit to other people for that accountability. So understand you don't get the sense of time that other people have, and you've got to find ways to compensate for that. Number two, your working memory is shot. You are like me at age 71 times